Welcome to our AFA's webinar. We're going to be talking about the Rural Healthcare Transformation Grants Program coming out of the Centers for Medicaid and Medicare. I've got a great team here to chat with me about that. So we've got Glen Disque, who's the State Director of Montana for Apprenticeship, and then Madeline and Boehm, who's a longtime friend. Both are actually longtime friends and colleagues. Madeline coming out of the HCAP program, who is building registered apprenticeship programs for healthcare and doing a lot in the rural workforce space as well. I guess what I'd like to do is just to start off, if you want to go ahead and put your name and organization in the chat. Would love to hear about that. And if you want to chat anything about what you're doing on the grants program, would love to hear that too, or any questions you have to get us kicked off. We're going to cover some questions at the end. But to help get us started, I'm just going to do a little overview from my perspective on the rural health transformation program. So first off, it's a very large investment in our infrastructure around rural healthcare. One of the largest that I've been aware of, and actually one of the largest that we've seen in years. So we're going to talk a little bit about what this program is. It's not just about funding, but it's really about how we rebuild healthcare and deliver it in rural areas. It creates opportunity to rethink how we build the healthcare workforce, how we think about apprenticeships in that space, whether it's the allied trades or in higher level occupations. And that apprenticeship is not just going to be a side strategy, but it's a core workforce development solution embedded in the grant program. So first off, this is a state-led transformation effort. So that's a critical part, is that this funding flows directly out to all 50 states. It's a $50 billion investment over 5 years. So every state will receive a significant amount of funding for this transformation. It's not just workforce, it goes a bit broader, and we'll get into that in just a second. So it's really a system design effort to really rethink how we deliver rural healthcare in the United States. So states have the flexibility to design their own approaches. Every state's going to get some baseline funding, and then based off of their rural population as well as the need, and then some scoring, that will determine how much they're getting. So it's not one program, it's really 50 different strategies for each state. So when we think about that, there's a real opportunity to rethink about how we approach this opportunity to use apprenticeship, how we can do that flexibly, how we can use that registered apprenticeship as a clear workforce strategy for the healthcare industry. So especially in rural areas like where I'm from and Glen's from, and Madeline, I think you're pretty rural yourself too. These are important aspects of how we really develop talent. And we're just simply not producing enough healthcare workforce. If you look at the current, BLS data, the current projections, we have an aging population, but also we have a growing need for workers in that field. It's one of the areas that where other sectors may be shrinking in terms of that skilled workforce. Healthcare continues to grow exponentially. So let's get into how a little bit how Centers for Medicare and Medicaid are thinking about this. So they laid out 5 goals. One in particular is workforce development. So states can use these funds for recruitment, retention, even service-based incentives to support rural healthcare practice. And importantly, it's not separate, but it's one of 3 levers alongside technology and care redesign, along with modernization, that they're really thinking about deploying. So apprenticeship fits into this framework in a way that we deliver modern workforce development. Of course, apprenticeship is an earn and learn model, which is a lot of what healthcare in rural communities really needs. It needs people that can train locally and stay locally. So states can use these RHD funds to support apprenticeship program development, fund some of the training costs, including on-the-job training. And my read is that they can even be used to incentivize employers to participate in the program from the start. So for sponsors, apprenticeship sponsors, it's a real chance to redesign and align to state funding in a way that we have not yet seen before. So let's talk a little bit about kind of further in depth on what this funding looks like. So the funding structure is designed to do two things. It's to ensure participation and reward performance. Half the funding is baseline funding, as I said before. So every state is going to have resources. More are going to have additional funds based off of their need, as well as the rural population in the state. And the other half is tied to execution and some outcomes. And on apprenticeship, this is really important because it's one of the few strategies that actually deliver results. So think about measurable starts, measurable retention, measurable completion. So if folks can mute, or if Freddie, you can mute folks, that would be great, getting a little bit of background. And then states can really lean into whether and how they're well positioned to show those outcomes over time. So a couple of examples I wanted to pull in here, just to kind of show the breadth and depth of what is happening in the states. We've seen that states are taking various approaches when it comes to apprenticeship. Virginia is a great example of building explicitly for the allied health apprenticeship model. We can talk a little bit about what those allied health trades are when we chat with Glen and Madeline. Alaska is another one that's focusing in on access and innovation. They haven't specifically said they're going to do apprenticeship, but pharmacy expansion, remote delivery, and then South Dakota, again, is thinking about focusing in on core delivery redesign. So, as Glenn and Madeline and I spoke earlier, lots of states are in different phases of this, just getting started, getting the funds out the door. We're going to talk a little bit about what that status is in a few moments. But, if there's one takeaway, it's this, the program is not just about healthcare, but it's building a rural workforce that can sustain itself. Apprenticeships are going to play a big part in that to give states the tools to do exactly that, to train locally and get folks to be retained locally. So, with that, I want to welcome my friend Glen Disque, who's the Montana State Director, and he's going to give us a few remarks to get us started thinking about what this looks like for apprenticeship in a very rural state. In fact, most of Montana is rural. So let me kick it over to you, Glenn, and thanks so much for joining.
Thank you, Zach. Um, Good afternoon or good morning to everybody, I guess. If you're over there with me in the West, it's still morning. Thank you guys very much for having me here. My name is Glen Disque. I am the director of registered apprenticeship for the state of Montana. I did see some other apprenticeship peeps in the chat. So I saw Joanne in there. She's down in Arizona. So it's good to see you guys. Um, Montana does have its own kind of challenges, especially when it comes to rural settings. But and I'll get to those. But kind of just an overview of quickly of how we have approached the RHTP, um, and kind of how we're going to be utilizing and how we're strategizing using registered apprenticeship to kind of serve that. So, beginning in 2025, so the Montana Department of Health and Human Services actually developed and submitted the Rural Health Transformation Plan, which included five core initiatives. So one of those and the first one is workforce development. So the Montana Health and Human Services, they're going to serve as the lead. So they kind of direct where all of the funding goes and kind of the larger strategic directions. But they're going to partner with the Montana Department of Labor to manage all the workforce initiatives, which of course includes registered apprenticeship. So the coordination of all these disparate elements like DPHHS, the Department of Labor, different educational components, and of course employers is a challenge. But one of the things that Montana has that's really kind of helping our kind of strategy is a initiative called the created by our governor. Called the 406 Jobs Initiative. So if anybody's been to Montana, Montana only has one area code. So that's 406. So it's kind of near and dear to us. And you'll see that quite a bit if you do travel around in Montana. But um, in this context, it signifies four pathways to a career. So it's military, education, entrepreneurship, or a career, which apprenticeship is a big part of that. Um, Zero barriers to work, and six high demand sectors. So healthcare is one of those six high demand sectors. So we've been working on developing a lot of healthcare initiatives and apprenticeship, really because of the 406 initiative. And this was started before we actually got rolling with the RHTP. Um, so apprenticeship really does fit perfectly in this initiative, not only as kind of the career pathway, but we really do. Apprenticeship helps remove a number of barriers, the least of which would be, costs associated with licensure sometimes. Travel to, especially in rural areas, that can be a challenge. Um, and then, in rural healthcare, we do kind of help that 406 Jobs Initiative really does help align a lot of our state agencies kind of with employer-led strategies. And of course, apprenticeship is probably the key kind of employer-led strategy for workforce development. So let's see. Funding was approved late last year, and I think we got north of 220 million, I think. So it was, I mean, especially for a state like Montana, it was a lot, and it's kind of a lot to deal with and to dig through. So when that was approved late last year, we kind of began the implementation phase this year. So we started hiring staff. We've got two staff for registered apprenticeship that that focus solely on the RHTP. Um, we actually utilized two of our staff that have been around for a while because if anybody in apprenticeship knows that healthcare in particular can be a challenge. It's very nuanced and there are specific challenges to apprenticeship in the healthcare industry. Um, so we use that to hire a couple of folks, and we're launching some initiatives to help kind of train and upskill um, healthcare professionals in rural Montana. Again, we've been doing this for a bit, but now this grant really does kind of help us hyper focus on that. So we're focusing right now heavily on developing pathways for high demand licensed occupations. Interestingly enough, I mean, one of the I keep hearing from a lot of the hospitals, radiation technologists, so rad techs. So that's one of the occupations we've been developing, like rad tech, LPN, clinical lab technicians, and clinical lab scientists. Um, and then kind of bridge programs like LPN to RN or a limited permit X-ray tech to rad tech. To kind of help us determining those kind of whatever high demand occupations are. We do use a lot of labor market data, vacancy information and projections. But we also, one of the nice things about apprenticeship and one of I guess one of um, the the intrinsic values of apprenticeship is that it's employer driven. So we do get a lot of feedback, direct feedback from employers, hospitals, and clinics to kind of find out which occupations maybe are the hardest to fill, um, maybe are have higher turnover. Um, and we kind of can fit and tailor our approach to kind of fit their needs. So apprenticeship is kind of really the perfect tool for this. It's employer-led, industry-focused, and our teams are kind of working directly with the employers to build programs that will serve exactly what they are going to be looking for. Again, staying within kind of the licensure requirements. I say this, and Joanne is on here. She's probably heard me say it 100 times. But especially when I'm talking to folks that are out of Montana or maybe not familiar with Montana, I say this all the time, just to kind of illustrate how rural some of our areas can be. So Montana is a very rural state, population just north of 1 million. And it's something like 46 of our 56 counties are designated as frontier. So a frontier county means that that's a federal designation. So frontier county means that there are at least there are less than 6 people per square mile. Um, this provides employers in those rural areas with very, very specific challenges to finding skilled workers. And it's especially difficult when you're talking about critical industries like healthcare. Um, so apprenticeship is kind of uniquely suited to help support those RHTP efforts in rural Montana by helping employers develop tailored training programs to upskill and train their folks from their own communities. It's very difficult to get people to just kind of import into some of these rural areas. So you have to really work with what you've got, especially when it comes to adult learners. You know, a lot of them can't uproot their lives and travel. In some areas, a community college is a 4-hour drive one way. So that's a very unique challenge that a lot of folks in rural areas, and I'm sure Montana isn't alone, but we definitely have that as a big issue. So finding remote options for related instruction is going to be a critical piece, especially in Montana, for our strategies. So especially for licensed occupations that are going to require a like an associate's degree or higher. Um, it is going to be really important to make sure that we find um, educational options that fit what the employers need, but are also kind of remote and help fit what the apprentice can, one, afford, but also physically attend, right? Um, so asking people, you know, if um, we can find good remote options is going to be probably one of the biggest hurdles that we've got. Um, so I guess when we're looking at the RHTP in general for and how registered apprenticeship is going to fit within that model, you know, we are going to be the source for upskilling and training local talent to fill a lot of these very high demand and very hard to fill positions. Um, and what I'm hoping is that our retention rates will continue. Right now in Montana, I think we're at 86% of our apprentices that graduate are still with that employer 5 years after they graduate from an apprenticeship program. And I believe we're up to 90% are still in that same community. So I think what we're looking for is really trying to help um, upskill and retain that talent in those communities, especially in the healthcare realm. But that gives you kind of at least an overview and a kind of big picture look at kind of what we're doing in apprenticeship as it relates to the RHTP.
That's great, Glenn. It's so interesting to think about where I live in a rural area and then imagine a frontier area, which, for how many counties did you say were considered frontier out of the 50?
About
All of them?
46, I
Yeah.
think.
Yeah.
it's funny, I was looking through unemployment data, and they've got the economists put together some data for me by county. And there were a couple counties that, like, the people that are unemployed, it was like 15. It's
Mhm.
like, oh, that'd be easy to track down and find. Hey, do you need a job?
So, Glenn, I'm wondering if you can talk a little bit about like how apprenticeship fits in the broader strategy that Montana is taking. As we talked about earlier, these grants are not just going to be workforce. What we're talking about today is just going to be how we deliver apprenticeship inside that. But how are you working with other agencies in coordination with kind of the broader 200 million that you all received this last year?
I think again, and I kind of have my focus right now on apprenticeship, and that's kind of my blinders. I try to stay in my lane, but I think as it really, one of the when you're talking about the coordination between all these kind of different agencies, especially Department of Health and Human Services, Department of Labor, I mean, these are massive agencies. Um, and this is a huge undertaking for DPHHS. I mean, massive. Um, I think, if I remember correctly, I think the workforce initiatives have 20 million, I think. So, I mean, it's in the large scheme of things, it's really not the the big focal point. However, I think how we really can fit into the broader strategy is providing something that's really unique about registered apprenticeship when it comes to workforce development is the interaction that we have with our employers. And Montana, in particular, is a little bit different. We have very, very close relationships we build with our employers. So, for instance, right now, I think we've got 745 active employers across the state that host registered apprenticeship or that sponsor an apprentice. And that's different in Montana because we don't really utilize a lot of the intermediaries. We do have a few, but we're just different in that respect. And I think one of the things that we're able to do is provide good data and feedback to the larger organizations about what employers are needing and seeing. I'll give you an example. Everybody cries about nursing, right? RN, RN, RN. And when we're out there talking to employers, yeah, a lot of them do say RN, but they also tell us, look, I really need rad techs. I need
Mhm.
respiratory therapy techs. I need surgical techs. Um, so I think it helps provide that data and that those interactions help provide um, color, if you will, to a lot of the labor market data information that we can provide back to the Department of Health and Human Services and that we can provide to the DLI as a whole. I think our interactions directly with employers really does kind of fit and will provide direction to a number of different parts of this grant.
When you think about the strategy Montana has, do you feel like apprenticeships are going to be central to the workforce strategy, or is it still kind of emerging, or it's still kind of like, employers are not yet used to apprenticeship, where you're going to be introducing apprenticeships in healthcare, especially in the allied trades, for possibly the first time?
I think a registered apprenticeship is going to be critical.
Yeah.
Now we've had a good run of, and again, like I said, our 406 Jobs Initiative, healthcare is a big part of that. So we've been working on this. So we kind of had maybe not a running start, but maybe a walking or a limping start when the RHTP came out. But um, I think when you're looking, especially at rural healthcare and developing skilled talent, especially in licensed occupations, apprenticeship is the most effective tool to use. Um, it's not just an effective tool. I mean, it really is the most effective way to find somebody within your community and help them develop the skills necessary and get um, the required licensure to provide those skills in their community. I don't think when we're talking about kind of especially upskilling, going from if you're a CNA and you want to become a nurse, being able to provide that to
Hmm.
somebody that's already entrenched and rooted in their community, to keep them at their employer, to provide them with that pathway as they're being paid. I don't think that there's a better way to do that, especially in rural America.
Well said. Madeline, I'm going to kick it over to you. Madeline is our intermediary with HCAP, who covers all types of healthcare apprenticeship programs across the country, not just in Montana, even though you are located in Montana. And Madeline, go ahead and take it away.
Thank
Thank you
you,
for
Zach. So, HCAPR, the Healthcare Career Advancement Program, is a national labor management organization. In 2016, HCAP became one of the first to contract with the U.S. Department of Labor as an industry intermediary and has been developing and expanding apprenticeships in the healthcare industry now for the last 10 years. We've received other funding to do that. We had a Closing the Skills Gap grant from the U.S. Department of Labor, which allowed us further expansion. And now we are working with both private foundations and state partners to continue our registered apprenticeship work. As an industry intermediary, we offer technical assistance to develop registered apprenticeship programs, assist in working with either the U.S. Department of Labor or the State Apprenticeship Agency to get those registered. We help develop the on-the-job training competencies. We partner with education providers for the related technical instruction. We engage with workforce systems to assist in funding and other resources. We strategize on recruitment and retention strategies and have been able to provide incentive funding to launch programs. We are based in New York City, but as Zach said, I do live in Montana. So our rural work has been particularly important to me. I understand how important rural healthcare is to rural communities. In many rural counties in this country, the healthcare provider is the largest employer. HCAP has worked with several rural programs supporting their apprenticeship work. We worked with St. Joseph Regional Medical Center in Lewiston, Idaho, on a medical assistant apprenticeship. Lewiston has a population of about 35,000, but is the only full-service healthcare provider between Boise and Spokane, Washington. We have funded medical assistant apprenticeships in Glendive, Montana, one of the coolest towns in Montana. And it has a population of about 5,000 people near the border of North Dakota. This hospital serves a 10-county region of eastern Montana, an area which is bigger than a couple of our states. When I wanted to do kind of a quick level set on healthcare and workforce disparities between urban and rural America. 1 in 5 people in the U.S. live in rural areas. Rural residents in the U.S. face significant health disparities with higher rates of chronic illness, injury, and premature death compared to their urban counterparts. Rural residents are more likely to die of the top 5 leading causes of death in this country: heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. Some of the big challenges include limited access to care due to hospital closures, provider shortages, lower socioeconomic status, and geographical isolation. Rural Americans are more likely to live below the poverty level. They are more likely to rely on SNAP benefits. They have greater transportation difficulties. Rural youth are more likely to smoke cigarettes and use smokeless tobacco and die by suicide. Rural communities have more uninsured residents, higher rates of unemployment, which leads to less access to care. That's the healthcare picture. And then there are also critical workforce shortage problems in rural counties. 91% of rural counties in this country have been designated as a health professional shortage area or have that HPSA designation. which and having a workforce crisis leads to higher turnover, increased reliance on temporary labor, and limited access to care. The RN turnover in rural areas is pretty high at about 24%, with the cost to replace a nurse is estimated at $56,000, but my guess is it's higher than that. Rural Americans tend to be less educated. Only 19% of rural Americans hold a bachelor degree or higher, compared to about 33% nationally. They are less likely to go to college and are more likely to drop out. Online education can help mitigate this, but about 50 some percent of rural Americans still have limited access to high-speed internet. Another challenge is many communities have a hard time attracting healthcare professionals, which is why it is so important for them to have a grow your own or apprenticeship strategy for their workforce. There are many people in rural communities that would make excellent healthcare providers, but they don't want to leave to go to college for a couple of years. They have a long history in the area. They have family ties and connections. A lot of them are either taking care of their parents or raising children or both. And many of them also have other businesses like farms or ranches that they have to tend. If an employer can engage with apprenticeship and skill or upskill someone in their community, the chances are that they will have a very long-term employee because there's not another hospital down the street they can go to for a position. Recognizing the challenges of rural America is one of the reasons I am so passionate about supporting apprenticeships in these communities. There is a lot of growth potential for registered apprenticeship with this RHTP funding. 27 states specifically mentioned registered apprenticeship in their applications. For the states that put registered apprenticeship in their applications, some of them are state apprenticeship agencies, so they have somebody like Glen and his amazing staff to build the support of new apprenticeships. But some of them are OA states, so they don't have that ability to offer as much support. So that is where HCAP or other healthcare intermediaries can offer help to expand existing or create new registered apprenticeships. Zach, I'll turn it back to you.
Yeah, no, that's great. And in the chat, we were saying, just like how stark some of these stats are that you were reporting just on poverty and the connection to health outcomes. And growing up in rural Indiana, I mean, we would see it with our eyes. The level of smokers, the amount of tobacco use, as teenagers was really, really high, and it has direct outcomes onto, all the issues that you laid out from cardiac arrest to stroke to just a number of challenges. Was wondering, your thoughts, as you take on, the building these apprenticeship programs in rural areas. How does an intermediary like you really kind of fit in? Like, how do you make the pitch? Are you doing it like, ones and I can imagine a lot of it is ones and twos of apprentices, but how does HCAP take on that challenge?
Before being able to utilize registered apprenticeship funding, you have to have a registered apprenticeship program, which does take time and deliberation. The other thing is healthcare is the second most regulated industry in this country after nuclear power. So there are different regulations that cover the healthcare facilities, and then there's different that cover the healthcare workers, and then the education system for healthcare careers. All of these have to be understood and followed in a registered apprenticeship program. Many people in rural healthcare facilities, well, probably in all healthcare facilities, are wearing several different hats and don't have the bandwidth to make sure that their registered apprenticeship program fits in and meets all the regulatory requirements. So intermediaries like HCAP can step in and ensure that all those requirements are being met. For some facilities, we are also the sponsor, so that takes the
Yeah.
burden off of facilities as well. And, all of the intermediaries I have worked with are really adept at leveraging financial support to make it easier for cash-strapped healthcare facilities to embrace apprenticeship.
That's great. Well, tell me, in terms of how your strategy works, one of the things that we were talking about on our pre-call was like how an apprenticeship program may work in an urban area is going to be completely different than a rural area. Can you speak to that a bit?
I think one of the biggest challenges in rural apprenticeships is trying to find the related technical instructions. A lot of our healthcare facilities are 2 or 3 hours away from a college. And I actually have seen a big transformation since 2015 when I started developing registered apprenticeships in healthcare. And there are a lot more education options available online, I think partially due to COVID, but it is still a demonstrated barrier. There are people who would make amazing nurses or respiratory therapists, but just can't leave their community for a couple years. So we really work on building that education piece and making it more available distantly.
Is that typically where employers get stuck, in terms of building an apprenticeship program or the hurdle that you help them through? Can you talk about some of those hurdles that employers are facing when kind of doing a startup in a rural area for healthcare? I can imagine licensing and accreditation becomes an issue as well.
Yeah, I mean, I think, and I'd be curious to know what Glenn thinks too, but I think that is one of the biggest hurdles in the healthcare industry.
Yeah. So what does success look like for you all, like in terms of like you're building your game plan now to be able to go to perhaps one of these 27 or more of these 27 states that have registered apprenticeship in part of their plan. What would you like to see successfully done with the dollars that CMS put out?
So I talked to a rural facility in South Dakota this morning that had a medical assistant apprenticeship program and has zero of their graduates leave. They are all still employed there. I talked to another rural facility last week that suspended its apprenticeship program only because they filled all of their current positions and have no more openings. And I think that's a good success. The other thing is I think that apprentices are better equipped to hit the ground running on day one after completing their education and whatever licensing requirements they have, because the onboarding, orientation, and introduction to that facility has already been done. I'm convinced that apprenticeship leads to better care outcomes for both residents and patients.
Yeah, makes a lot of sense. Well, Glenn, how does Madeline's perspective sort of hit your ears? Is it sort of like kind of similar trends that you're seeing in Montana when you're approaching this grant opportunity?
Yeah, absolutely. And Madeline and I are kind of cheating because Madeline and I work together. She actually used to work with me in registered apprenticeship in Montana. So she's very familiar with kind of what we're facing, and she helped actually build a lot of the programs that we've got here and that we use.
That's great. And Madeline, based on what Glenn shared, what advice would you give for states that these 27 states that are have registered apprenticeship in their plans? Like what would be some of the first steps to kind of getting their arms around this kind of larger holistic effort to tackle workforce development in rural areas, kind of taking on these issues around poverty?
Thank you. I think the biggest way to success with apprenticeship is collaboration. That if there is a state apprenticeship agency, you've got to work with them. They know so much more than coming in as an outside industry intermediary, and they can really help lay the groundwork and tell you where you might be useful to do your work. find the associations and networks in your state, get them engaged. A lot of times, when we started this registered apprenticeship in healthcare in Montana in 2015, it was under a TACT grant. And the Montana Hospital Association was a big player in that TACT grant. And they could open doors that me coming from a state agency saying, hey, I'm here to sell you an apprenticeship would never work. But, get those trusted partners engaged, I think is really, really important.
That's great. And I'm going to open it up to questions from the audience a little bit. But before we get to those questions, Glenn, I was thinking, in the conversation that we had, like, is there something that you all do specifically in kind of these rural settings for healthcare positions that sort of unlocks the opportunity for smaller organizations to adopt apprenticeships?
We do, I think, and to kind of piggyback on what Madeline was saying, that you know being able to collaborate with a number of different organizations, because finding on the apprenticeship side, when we're developing new apprenticeships or if we're working with an employer, that's only one half of the equation. So the other half is finding the right person to fill that position. Or if you're going to upskill, for instance, a CNA to LPN, you know, finding that other person to kind of backfill that CNA position. Um, so I think being able to coordinate efforts between, like what Madeline was saying, different associations and organizations, with also other parts of our kind of workforce family, if you will. So our job centers, to help connect job centers with the employers to say, hey, here's a group of folks that might be interested um, in a career in healthcare, getting them involved with the high schools, and opening up some of those pathways and making it a little bit more accessible for the local community members um, to get involved and get into an apprenticeship program. We're typically in those communities, so we can help facilitate a lot of those connections.
That's great. We did get one question in the chat, probably for both you and Madeline, Glenn. But how are you engaging high school CTE, adult ed, etc.? Are you developing a pre-apprenticeship pipeline when you think about some of these tracks into the registered apprenticeships?
That is a fantastic question. And yes, the quick answer is yes. We do develop pre-apprenticeship programs. We have requirements in the state when we do recognize pre-apprenticeships that will help schools, adult ed. We're revamping all of our pre-apprenticeship programs in the prison system, um, to and then in order to get recognized as a pre-apprenticeship program, they do have to get connected to an employer. And that really does help provide employers with a pool of candidates. Now, they don't have to hire any of them if they don't want to, but we do require that every employer provides a pre-apprentice who graduates with an interview. Um,
Yeah, just
so
kind
at
of a
least they're
follow
giving
up
that.
on that, Glenn. Are you looking at high schools as, kind of part of the talent pipeline for rural healthcare? Is that does do you basically need a lot of pre-apprenticeship in high school to be able to enter some of these licensed trades? Seems like there would be some limitations on age. Also, like, for example, lifts, if you're supporting patients, lifts are limited to those that are 18 plus. Are some of those challenges that you're overcoming in some of the high schools or developing around?
We're developing around more than anything. And a lot of what this RHTP grant is going to do is to establish, for instance, like HOSA type organizations in those high schools, that can help kind of house, for lack of a better term, pre-apprenticeship programs for those occupations that will get people. I mean, really, a pre-apprenticeship program is to provide somebody with the basic elements to get started in that career. It's you know, I think one of the biggest advantages that a pre-apprenticeship participant has is just getting kind of steeped in that industry a little bit to see,
Mhm.
everybody, if you're in high school, you're really looking at in healthcare, you're maybe thinking of 4 or 5 different occupations. But once you get into that setting, you can actually see just the myriad of different things you can do in healthcare. I think that is probably one of the biggest advantages of getting a pre-apprenticeship going. And then, of course, the direct connection with the employer, having that kind of warm connection. So, um, you know, people aren't, afraid to go apply for a job, for instance, and maybe giving them um, the support, I guess, and getting that career started.
Makes sense.
And I would also say that with the RHTP in Montana, a lot of this facilitation is being done by the Office of Rural Health, which is at the Montana
Mm,
State University. And they also oversee all the area health education centers or AHECs in the state. And the AHECs are very good about engaging high school students. They have a Med Start camp where they take students into hospital settings for a week in the summer. They have a Heads Up camp, which is specific to behavioral health care and what it looks like to be a behavioral health care provider. So I think that level of pre-apprenticeship is being engaged throughout.
One of the questions I had for y'all, being that you're based in Montana and there are lots of tribal organizations, lots of the state are is considered tribes. Is that part of the strategy here as well? Or are they an eligible entity to be able for the state to serve and to support rural healthcare in those areas?
It's a huge component. There's a lot of the rural areas of Montana are reservation areas. So we're going to be working very closely. We've got the Department of Labor, we've got a tribal liaison that helps us kind of facilitate some of these conversations, but working directly with the community colleges on the reservations has been very successful in the past, and we'll continue to kind of do that to help create these apprenticeship pipelines into those tribal areas. But yeah, that's going to be a big part of it.
Super helpful. Madeline, there was one question in here for you that specifically on how to get in touch with HCAP, how to engage with the services that you all provide. Can you talk a little bit about what that looks like?
Sure. So we no longer have our industry intermediary contract with the Department of Labor. They have put out a second round, um, or I guess a third round of R8, shoot, request for proposal, sorry, which is due next week. So we are applying for that. But we're still willing to offer a lot of support in building an apprenticeship. We don't have that funding stream through the Department of Labor. But we can leverage other funding, which is what we're doing for a lot of other projects. And I
Excellent.
will put my email in the chat. Right now, it's the easiest way to get a hold of me. So
Great. Speaking of funding, do you all leverage either Glenn or Madeline? Do you all leverage WIOA, work with local boards? Is that something that has been a part of your strategy? I mean, will that be a part of how you're going to support, say, sponsors at the local level by blending some of these funds?
we've worked a lot
I
with workforce boards. And we have some partners that have really figured out the WIOA stuff, but we haven't done the WIOA stuff directly. So
we do every once in a while. Montana, when it comes to the registered apprenticeship side, Montana doesn't have like a as big of a WIOA bucket of as one might think. So most of the time they don't have a lot of our job services don't really have a lot of a difficult time, I guess, getting through their wheel of funding and helping people. Where it fits really well. Not only in the healthcare arena, but in a number of areas. We have actually next month, I'm going to a graduation for an electrician that was a that got wheel of funding. So it can be very, very useful. And again, where it fits really, really well. I'm not as successful as other states. Like Joanne does a really good job with in Arizona does a really good job with braiding wheel of funding. So if anybody is interested in kind of how those experts do it, Joanne would be a good person to reach out to.
Madeline, I think this question in the chat's for you. As you're building out these apprenticeship programs, are you integrating what the Deanna calls power skills, things like communication, emotional regulation, and resilience, especially related to health, mental health, or trauma-informed practices? And do you do this with supervisors and frontline managers?
It all really kind of depends on what the employer sees as a priority. I think that that would be great to have this embedded into pretty much any healthcare apprenticeship. And it really depends on what the employer needs. We did, when I was working for the state of Montana, develop a success skills tool on, I think it was 5 different modules on 5 different ways to be successful at a healthcare career. And I have made those available to some employers who are interested in utilizing those. But like all things apprenticeship, it is really up to the employer on whether how much of that they want to do.
That's great. Yeah, that makes a lot of sense. Well, let me close us out here. Really appreciate all the questions that have come in from the chat. Gonna leave you with some helpful websites to take a look at when you're thinking about the rural healthcare, this transformation grants program, thinking about apprenticeships too. So a few websites here from CMS where you can kind of dive a little bit deeper on what CMS has funded, their priorities, some of the state examples and abstracts you can find there. Also, want to remind you that you can come to Apprenticeships for America for any questions that you have on apprenticeships. Also, want to make sure that I invite you to our national summit. It's coming up next month. Will be the 19th through the 21st. We'll have some pre-cons on the 19th. The main days are the 20th and the 21st. 5 plenaries, 30 different sessions that we're holding. And lots of my friends will be there. We're about to sell out. So just invite you. If you want to be here in DC, it's going to be a lot of fun and a very, very informative and a chance to connect with the entire apprenticeship community. So get your seats while they last. And then just a few other key resources. When you think about grants coming up in the future, check out grants.gov for anything related to Department of Labor grants or to CMS. And then I've screwed up this last website, but that should be apprenticeship.gov. That's your government website for the Department of Labor and all things apprenticeship. So check that out. And thank you all for joining us. It's been just fabulous conversation on healthcare, and we dived really deep here. Appreciate y'all, and we'll see y'all next time.
Thank you.